testing of the foot. If you're testing the medial side, you stand on the lateral side of the foot. If you're testing the lateral side, you stand on the medial side of the foot. And for the joints running in that sagittal plane, you stand head on to the foot. So talo-navicular, I'm going to stabilise the talus, grab the navicular and glide it plantally and dorsally. You'll notice it will rotate when you do that as well, and that's a conjunct rotation of this there. Then I'm going to stabilise the navicular, move the 3 cuneiforms on it, plantally and dorsally, that way, same conjunct rotation again. And if there is a problem, then you're going to test each one separately on the navicular, medial, middle and lateral. Then we test the bases of the metatarsals on its navicular, plantally and dorsally. They conjunct rotate the same direction as well, and there. So looking at the lateral foot, come on to the inside of it, come down a wee bit this way for me. And we're going to start with the calcaneal cuboid. We're going to stabilise the cuboid, glide the calcaneal, stabilise the calcaneum, glide the cuboid, like dorsolaterally plant over medially, there, which is the joint glide, but the functional movement is dorsal and palmar, and this is the way it moves during walking. Then stabilise the cuneiform, grab the metatarsal bases, move that on the cuboid, and then the fourth on the cuboid, like so. Then we're going to deal with the joints in this plane. The cubonavicular joint, dorsolateral glide ventromedial, so this way, there, and then the cuboid lateral cuneiform joint there. Again, dorsolateral ventromedial. And they are the joint glides that we won't need to worry about. So to manipulate this, if this has gone dorsal, then we'll bring the foot up. If you need a stabilizer, you put it under the proximal bone, and you can use a crutch tip or something like that, but something that's reasonable that's going to hold it up. Otherwise, you can just hold down there, you're going to apply traction there. The patient can help if they grab the leg, if you need it. You don't always need it. They just grab it and lean back. I might as well do it. Grab it and lean back there. And then I'm going to come onto, we've got the talus, talus stabilised underneath the head, if we need it. And then come onto the dorsum of the navicular, lean on it, find the worst end feel, thrust down. Okay. Then we can move down, stabilise the navicular, come onto the cuneiform, and thrust that down. The middle one's much the same there, and the lateral one's the same. Just have to change the angle as you're doing this there. And then the metatarsal base is the same thing. Stabilise the cuneiform onto the base of the metatarsal and thrust that down. Now the second metatarsal is a little different. As this comes up, goes dorsal, the head comes down. So they start weight bearing on the head, which is going to lead to metatarsalgia, possible stress fractures and so on. To do this one, you're going to thrust down on the metatarsal base and at the same time lift up the head. So you sort of seesaw it over. So this goes under the head to lift it. I can do some traction here as well. Make sure that you are on the base of the metatarsal, not the shaft, because if this is weak, if the bone's weak, then it could fracture the bone. So find that base there, and then I'm going to basically thrust down on it and lift. So it's that. If I exaggerate, it's that. Okay, there's the dorsal mandibles. Plantar mandibles do exactly the same thrust, but we thrust the different bone. So now, if I want to take the navicular plantarly on the talus, essentially what I'll do is stabilise the. So I want to take it dorsally on the talus. I'll stabilise the navicular, thrust down on the talar neck there. So I want to take the cuneiform dorsally on the navicular, stabilise the cuneiform, and thrust the navicular down on the cuneiform and so on. So stabilise the cuneiform and then onto the base of the metatarsal. So it's simply about reversing the thrust point. Okay, laterally, cubo-calcaneal. That will stabilise the cuboid there. Patient can give you traction if you need it again, and you might do with this one. You're going to find the joint, well, the joint axis is anterolateral, so if I rotate the leg in, it will become vertical. Take the fourth and fifth metatarsals, there's my traction, lean back, and come onto the cuboid and thrust down on the cuboid. Okay. A couple of plantar manips. Stand up. Okay, so this is a plantar cuboid using a horseshoe technique. Cuboid distal to the weight bearing area of the sole, the dark skin there. Find it, you'll find the ridge about in line with the second or third metatarsal. There it is there. And I'm going to keep the foot dorsiflexed as well as I can, and I'm just going to shove the leg backwards and forwards, and the thrust is going to be that way, dorsolateral. So I'm actually inverting this. It's an inverted subluxation, and it's that. Okay, I can do the navicular in this same way. Come onto the underside of the navicular here, and same thing. I can do that, and then I'm going to thrust it that way. Okay, they're the manips for the foot.